B4B TV. Real people, real stories, real Bradford.
Welcome everybody to another episode from Bradford for Better. This is one I haven't done for a little while, but the last one I did do was about the clean air zone. So I'm pleased to say that we've got the same guests as we had at the first clean air zone episode, but we're missing Professor Jim McQuaid. We have here Professor Rosie McEachan from the Bradford Institute for Health Research and from the University of Bradford, and Sally Jones from Bradford Council, both of them who are working very closely with everything that's going on with the clean air zone. Just as a reminder, we did the first episode just to cover a little bit about what the clean air zone is, why it's important, why we even have one, and how it will work in practice. So Sally, if I can just invite you to just give us a little reminder, just to say what the clean air zone is, and we'll pop the first episode in the link within this podcast. But if you don't mind just giving us a little summary of what one is in terms of a clean air zone.
Yeah, so a clean air zone is where you decide that you've got an area where you need to improve pollution, and you create a boundary around the outside of it, and you use cameras to control the vehicles that can go in and out of that area. So what we've done in Bradford is we've created a zone that includes the outer ring road and up to Shipley, and there are cameras that pick up what vehicles come in and out, and what we are doing is keeping out older commercial vehicles, because they create a lot more pollution than much of the cleaner vehicles, and that will improve air quality.
Yeah, and so this was not an optional thing, was it? This came from national government guidance, and there was about 30 plus cities which needed a clean air zone. Is that right?
Yes, so there's legal limits on pollution that were allowed. It's not allowed to go over those limits. So there was a large amount of areas within the zone that we've chosen the boundary of that were exceeding the legal limit. We were asked by government to deal with that, and we were served a ministerial direction to put in place a clean air zone to deal with commercial vehicles. So yeah, the council did want to improve air quality, but we were actually forced to do it as well by government, quite rightly.
Yeah, and so Rosie, we had quite a few options, or the council had quite a few options to pick a certain clean air zone, and in the end they went for one which is very different to, say, Birmingham or Bristol. How did that decision get reached?
So we were delighted that action was being taken to reduce pollution. That's the first thing to say, because we know from our research that it's really bad for kids' health. But we also understand that implementing these types of policies, which do charge people, that's how clean air zones work. They charge the older vehicles. They can have unexpected impacts, and it's really important to be aware about how this might affect our communities. We did a lot of research. We went out to speak to lots of communities across Bradford, communities living in pollution hotspots, and we took a range of options that the council were working on and just got communities to be really frank and say, what are the pros and cons of these different solutions? And one of the key decisions for Bradford is, do we implement a clean air zone that charges people's private vehicles like they have in London, like they have in Birmingham, or do we have a clean air zone that focuses on commercial vehicles? And what we heard from our communities is very much they supported the drive to reduce pollution, but they were very concerned about the impact of potentially charging private vehicles we'd have on some of members of our community who are perhaps bit more financially insecure. So there was a clear message from communities about that. And there was also a clear message about taxi drivers, who were one group that, as part of the government's sort of framework, are always going to be charged. So we were able to create a report that summarised community views and take that back to Sally and the team. And that helped them to pick on a sort of compromise, which is a clean air zone which doesn't charge private vehicles, but does charge commercial vehicles. And it also enabled Sally and the team to get a lot more money from government, which could go straight out the door to taxi drivers to allow them to upgrade vehicles. So it was a really important piece of work.
Brilliant. And so the key question, I think, that arises from all this, Sally, is, has it worked? In other words, has it reduced air pollution?
Yeah, I'm absolutely delighted to say that it has. We've seen air pollution come down to the lowest levels we've ever recorded. this last summer. There's other cities have sort of flatlined since COVID, really. We're not getting the turnover of new vehicles across the piece, but in Bradford, we've got cleaner and cleaner, and we've seen air pollution coming down really nicely. So yeah, it's really good news.
And Rosie, from a health point perspective, tell us a little bit about what you can see in the data. Has it made a difference in terms of, for example, people accessing GP services or attendance at A&E?
Yep. Well, we have been tracking the health of the city of Bradford. We're particularly interested in lung health, so breathing issues and heart health. What we've been doing is looking at the numbers of people who need to go and visit their GP or visit the accident and emergency department for problems. And what we've been able to do is to compare what happened before the clean air zone was implemented, and because of the COVID pandemic, we've had to go back quite far in order to really understand what those trends were before it was implemented. And what we can see when we look at that data is that before we had this clean air zone in place, we could see sort of consistent increases over time of the amount of people that were having to visit GPs for particularly breathing difficulties. And when we compare that to a period after the clean air plan and the clean air zone has been implemented, you can see quite a encouraging downturn in the amount of people who are having to visit the GP. And we estimate that for breathing difficulties, there's around nearly 600 fewer visits to a GP per month for people having to go with breathing difficulties, and around 134 fewer visits for heart health. And just thinking about the savings alone, just from not having the GPs tied up with these issues, that is a saving of £30,000 a month in Bradford. So the early signs are really encouraging. This analysis was done a year after the Clean Air Zone launched, so it takes us up to September 23. We're continuing to track the health impact, and we're hoping later this year that we can sort of take that longer term view. But it's encouraging as a researcher to be able to see the impact of what was a very ambitious and quite divisive policy at times, but it looks like it certainly seems to have been the right thing to do, and we're seeing that impact.
That is really promising, really encouraging, and it's good for both the economy and people's health. So, Sally, one of the challenges that I think you were faced with right at the beginning before the Clean Air Zone was implemented was many people were saying, well, this is just another cash cow. It's to try and make money for the council. But there's a lot of evidence that this money that does get bought into the Clean Air Zone actually gets used for really good causes. Can you tell us a little bit about that, please?
Yeah, I mean, the first thing to say is that we don't want charges from people. We want them not to bring in their old vehicles. The best clean air zones don't charge anyone and make no money whatsoever. That said, some people are choosing to pay a charge and come into the zone in those older vehicles. And when they do that, that money is ring fenced into a pot that is put to one side to further improve the problem. The council can't just spend that on, normal council services. It's actually ring fenced to further improve air quality. So any money that's collected actually helps. One of the first things that we set up was a Clean Air Schools programme with that money. And that money is being pushed straight back out into communities to provide bikes for kids, air filtration in classrooms, green screens along the edge of playgrounds, and a full programme of dealing with idling vehicles around schools as well. So the money is being used to further help the problem.
That's brilliant. So schools can bid for this money, or is it only within the clean air zones where the schools are located?
It was across the whole of Bradford. Unfortunately, that fund's now completed and £500,000 worth of funding's gone out the door. I don't know at the moment if there'll be another future round, but all those projects are currently being implemented at the moment, and there's lots of great work going on in schools. But it was available to all schools across Bradford, not just those in the zone.
Brilliant. Thank you so much. I think this is a good point to at which we can end. I thank Professor Rosie McEachan from the Bradford Institute for Health Research and Sally Jones from Bradford Council for joining us. Please like, share and subscribe to the podcast and to the YouTube links, and I look forward to meeting you at the next one. Thank you.
You've been watching B4B TV. Don't forget to like, share and subscribe. And join us next time for another episode.